Tuberculosis, or TB, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It can affect many areas of the body, but mainly damages the lungs. Tuberculosis is spread through the air by an infected person coughing, sneezing, or spitting. Tuberculosis can cause mild symptoms for many months, such as coughing, night sweats, weight loss, and fever. If treatment is not sought out, the disease can spread to the kidneys, spine, and brain, and become very serious and even fatal.
Tuberculosis has been impacting humanity for years. Bacteria were even found in Egyptian mummies from as early as 2400 BCE. More recently, there was a major outbreak of TB in the United States and the rest of the world, which led to a rise in facilities called sanatoriums that provided a place for patients to rest and recover. This strategy was actually highly effective as it isolated those infected, reducing the spread of the disease.
There is a vaccination for TB, but it is not commonly used in the United States, as its effectivity is limited. Travelers or others who may have been exposed to TB should consider a skin or blood test to make sure they have not contracted the disease. Tuberculosis is typically not fatal if treatment is sought out, but in many third world countries where proper treatment is hard to find, TB is a major problem and often fatal. Over 10 million people were infected by the disease in 2015, and 1.8 million died from tuberculosis-related problems.
There are two forms of the disease, active and latent. Those with latent TB, almost 1/3 of the world population, do not exhibit symptoms and have around a 10% chance of developing active TB. Both forms of tuberculosis are treatable and curable. Latent TB can progress into TB disease, so the CDC recommends that anyone with latent tuberculosis get treatment, especially those with compromised immune systems, such as individuals with HIV or AIDS. Antibiotic drugs will be prescribed to the individual with tuberculosis.
Certain strands of TB are resistant to some antibiotics, so stronger drugs may be administered for longer periods of time, sometimes up to 9 months. It is advised to stay on medication until specifically told to stop, even if you stop showing symptoms before the assigned date to stop taking medication occurs.
Tuberculosis is common and curable, but can be very serious if not treated, and is a disease everyone should be aware of.